Because the pandemic not over quite yet, I think, unless Dr. Norem wants to correct me, we will have Dr. Norem, our friend here from Mercy Health, to give us the latest on the coronavirus, COVID-19, the vaccines, and all that good stuff. Dr. Norem, how you doing this morning?
I'm doing well. Another beautiful day here in Illinois.
It is beautiful. You're back here. You planning any Phoenix trips soon?
Tucson trips, not for a few more weeks. Hoping to avoid those 100-degree days.
Do that because it's supposed to be nice out here. So, all right. Well, it's been a week since we've talked to you. I'm sure you've done some more research, some more reading, all of that stuff. You still want us to take vaccines? Is that the deal?
We're still talking vaccines. Obviously, booster shots have hit the news, and a lot of discussion about that, and the FDA's recommendation to proceed ahead with what they call a third vaccine. They're not really characterizing them as boosters.
Is there a difference between a booster and a third vaccine?
Well, the argument is this, that they're saying that the people who need that third vaccine are people who did not get an adequate response from the first two. These are people that are very immune suppressed, organ transplantation patients, patients on high doses of chemo or high doses of immune suppressive agents. So the data suggests that even though they had the two shots, they did not get as good a response as they should have, so they need a third shot. So in a way, it's kind of a rhetorical argument. You know, it's a third shot. In essence, you're trying to boost their immune system, but they're not really wanting to say they're actually boosters. We kind of think of boosters in terms of our regular vaccinated people whose immunity has waned, and now we need to boost that again. So I don't know. You're kind of splitting hairs, but I kind of see their point.
So, real quick, I forgot the word you used exactly. How'd you say the people that didn't get full, how'd you put it, that would need the third shot?
Inadequate immune response from the first two.
That's right.
Their immune systems are so suppressed.
So how would one know if they got an inadequate immune response and need that third shot? Is that just something we talk about with our doctor?
Yes, and look at what the recommendations are from the FDA in terms of who would qualify currently. And again, it looks like it's organ transplantation patients because they're on high doses of immune suppressives, people who are receiving chemotherapy for certain cancers. Again, that really affects many patients' immune systems, and people who are on high dose of immune suppressive agents for other diseases, like high doses of steroids. And we've known that in the past. We've tried to avoid giving immunizations when people are on high doses of steroids and other immune suppressants because we know they don't get as good an immune response.
Gotcha.
Doctor, a quick question is it likely at this point for most folks who've been vaccinated that going forward we're all going to need some kind of a booster, whether it's because of what you're saying, maybe we had an insufficient amount the first time around, or just to continue to combat the current or any of the future variants, things like that? Is that a likelihood for most people?
Yes, I believe it is. For those reasons that you've just suggested, at some point our immunity will probably wane in all of us, even though we had initially a good immune response. New variants will probably pop up in the future. So I suspect all of us are going to need some kind of booster. Now, other countries, I believe Israel, is already proceeding ahead saying that anybody over the age of 60 who probably doesn't have quite as good immune response is eligible for a booster there. So I think it's just a matter of time in this country.
Breakthrough cases. Everyone likes talking about that right now. Last week you were on, we talked about, the percentage of breakthrough cases will inevitably go up just because more people are getting vaccinated. It's been another week. Do we know anything more about these breakthrough cases? Are they still in vaccinated people not as debilitating as in non-vax? What's new this week on those?
Probably not a lot new. Still reassuring that vaccinated people are likely to get very mild diseases. There are reports of people who've been vaccinated who have passed away from COVID. But again, I remind people that even though it's a very effective vaccine, it's 95%, which is excellent. That still means 1 out of 20 people do not get an adequate response. And unfortunately, there's no way to assess that in an individual to know whether you're that 1 out of 20. So those people are susceptible to more serious disease. But overall, again, people are well protected by getting the vaccine. You'll get a mild case. I just had a buddy call me who traveled to Florida, of all places, and he was well vaccinated. He's not anybody that's high risk. And he had a positive COVID, but he described it as a bad cold.
Tom, actually, I do want to get you in on this. You have you're down there in Florida. We up here in Illinois know what the push is like as far as wanting people to get vaccinated. We still have testing sites around here. What's it like down in Florida, Tom? Is there still a push to get vaccinated? Do you know where somebody could get vaccinated right now? Is that a message you're getting publicly?
Yeah, people are still getting vaccinated, and you can go to any Walgreens or different places, or maybe it's not Walgreens, but wherever there are places. It's been several months since I've gotten it, so I haven't been up on it. But I know that my youngest daughter just got 2 doses of the Pfizer recently, and I think it was a real simple around the corner type of a thing, one of the CVS or somewhere where they had it going on. But yeah, the messaging isn't so much of I don't know if I'd say it's a push down here. I mean, it's no secret. The Florida government is, divided on this subject to some extent, but it's definitely still going on. People are still doing it. I'm noticing a lot more. Believe it or not, even in Florida, I'm noticing a lot more masking going on in public places from people, including myself, because of everything, the latest stuff that's going on. So still happening. But yeah, Florida's well known for not good things right now in some ways regarding this subject.
I'm glad you brought up the masking point, because that's a point of major contention right now. What's your advice, Dr. Norem, if you're out and about in public? I'm sure you're outdoors still okay if you're not masking up, but are you recommending running to the grocery store, Walgreens, something like that? Would you be masking up?
Yes, I would recommend that people mask up when they go inside to any type of a store or public place. Outside, we're probably fine. I spent most of the weekend outside, thank goodness, so I didn't have to think about it. But I think it's probably a good idea. I mean, there's a lot of controversy, as Tom has pointed out. People get worked up and they complain because of all the mixed messages, and to some extent, that's somewhat fair. But I think people have to think of COVID as a battle with an enemy that keeps changing their tactics, and we have to change our tactics to fight COVID, and that sometimes means going back and doing things that were effective before that we have to go back and do again. It's not that we're changing our mind. It's we have to fight this thing with all the things that we can come up with. And we know masking is effective. It's not highly effective, but it is effective.
I think one of the biggest problems people have, when you say it's time to mask up again, it's not so much that it's that you said we could. I think people understand the fact that things change. I think one of the biggest concerns is, well, when will we be able to stop? If you tell me to do this now and I do this now, and are we going to have to do this all the way through, Valentine's Day next year? If you do think things have changed enough for people to go back to masking now, what would be like the signal that it would be okay to stop in a month, in 3 weeks? What is there a hard number that you're looking at to lower your guard a little bit?
I don't think there's a hard number. I think we have to look at the overall infection rate and see that it's clearly going back down to levels of a couple months ago. We're speculating now we're going to be pushing 200,000 new cases. That would mean we'd have to continue to mask. And I understand the fatigue. We all thought we were done with that for a while. Oh, my goodness, we're vaccinated. We don't need masks. Now people are saying, well, even if you're vaccinated, you need a mask. And you're going, oh, crap. Why do I have to do that? I was told I didn't need a mask. It's just human nature. It's frustrating. But no, we have to see a definite precipitous drop in new infections.
Can I get one more question in here, Joe, for the doctor? The idea that a vaccination, I've heard some people, especially down here, see, the sentiment is the vaccines don't work. Why do I need to get a booster or, get this or that or whatever? I already got it. I thought I was all good. And I think people are confused. Some are confused on the fundamental definition of what a vaccine is and what it's supposed to do. It's never been intended to be if you do this, you won't ever get this or that disease, right? There's a different purpose of a vaccine. Is that right, doctor?
Yeah, I think that's a good point, Tom. And I think I would kind of use the comparisons. We have vaccines that are highly effective. You get a measles vaccine, you're never going to get the measles. That's one end of the spectrum. The other end of the spectrum is the flu vaccine. We're all familiar with flu vaccines. And we've known for years you get a flu vaccine, you can still get the flu. Very common to see that, but it does help reduce the severity. So we're seeing the COVID vaccine, I think, closer to the spectrum of the measles vaccine, where, no, it's not 100%, but clearly people that get the vaccine are very unlikely to end up in the hospital and die. The numbers out there say the death rate in people who are dying, it's 99% unvaccinated. It's a very small percentage of people who are vaccinated. So that's the selling point I try to tell people. No, it's not 100% effective, but, you want to roll the dice and take your chances. I end up in the ICU and dying. Okay.
And then one last question here. Schools starting up here in the area and around the country. Lot of discussion about should we be in person? Hopefully, most schools are. Hopefully, we stick that way. What do you see happening these first couple weeks of school? Do you think we're going to have a couple of breakouts in schools? And one other question: I know vaccines approved for 12 and up. Are you fully on board of that age group getting vaccinated, going back to school here?
Well, number one, absolutely getting kids back to school is important. We need to do whatever we can to keep kids in school. Absolutely anybody 12 or older should be vaccinated to reduce the spread. And you're right, we're going to see outbreaks in schools. So we need to do masking and testing and quarantining and trying to keep kids separated. I know that's difficult, but I think as we've even said quite a bit as we've discussed this in the past, kids need to be back in school. This has been a lost year for kids. So whatever we can do to keep kids in school, I'm all in favor.
So, yes, you would definitely get, I know you don't have kids that age, but maybe grandkids in an age group, no problem at all, no hesitancy in giving this to the younger crowd.
Absolutely. My grandkids are all vaccinated except for the youngest two who aren't yet eligible, but they're 8 and 5. So we're hoping, and I think the last thing I heard, maybe late fall for the younger crowd.
And the younger crowd, do you think that will go down to even infants being vaccinated at some point?
I think maybe 2-year-olds. I think that's what they're looking at. I don't believe there's any study yet on anything any kids under age of 2.
Gotcha. Well, Dr. Norem, before we let you go, anything else you want to add before we say goodbye and wait for next week?
Well, I keep hoping that we could talk about discontinuing this conversation every Monday, but I think we're going to be doing this for several more months.
Doc, I can't wait to cancel this segment. It's going to be great.
All right.
All right,
guys.
That is Dr. Norem, our Mercy Health COVID expert.